Medical professionals of Reddit, when did you have to tell a patient, "I've seen it all before," to comfort them, but really you had never seen something so bad, or of that nature? Probably too late to the party, but I had a lady come into the listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood tests results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone, and her body was twisted in a decorticate position with her jaw locked open. Then the smell hit me: rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to oozing muscle fibers. Her calves were incredibly swollen and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. Her entire sacrum was exposed and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar. No surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. In dental school, I had an emergency patient come in, complaining of sore gums. Upon examination, I found a massive calculus bridge, Google it for pictures, behind her lower front teeth. She only had about 3 remaining lower teeth, but they were all connected with a whitish-brown mineral deposit that was about the size of a golf ball. She had never had her teeth cleaned and she was probably 55 or so. I basically performed an emergency cleaning. She could speak so much better afterwards. Of course I had to play it off like it was normal, but in my years of practice I still haven't seen a case that bad again. Get your teeth cleaned, people. Even if you can't afford every 6 months. Once a year, or every other year is a hell of a lot better than never. I showed up to a house for a possible overdose. 3 firefighters and a police officer were on top of a man who was prone and naked from the waist down. They immediately told my partner and I to restrain the patient to the gurney because the patient was combative. It turns out he took something thinking it was weed, but turned out to be laced with something else, possibly PCP. During his trip he attempted to cut his penis off, but wasn't successful. As fate would have it, I knew the patient personally and tried to comfort him on the way to the hospital. During the ride he became somewhat cognizant and was ashamed of himself. I tried to comfort him as I held his penis in place. I would be lying if I said I had seen a severed penis before. I worked as a mental health tech to get through undergrad. 15F in the adolescent ward claims to have swallowed a staple. But whatever. As I'm taking her down to X-ray, I tell her about the dime I swallowed when I was a kid. It happens. Well, turns out she underestimated the number of staples by around 100. Every printout given by the therapists had been a swallowed staple. She had gotten staples from the other kids. The X-ray of her abdomen looked as if it were a weird staple Y snow globe. And yet, somehow, she was back to trying to steal psych ward staples a week later. Never did figure out how they removed them all. A little late to the party. Not the worst. But I had a patient once with a stomach bleed and a small bowel obstruction. We had to put in an ing tube that goes in your nose and down to your stomach, to drain, decompress his stomach, which was pretty distended and hard. I'm inserting the tube and as soon as it hits this guy's gag reflex he projectile vomits and sprays very dark, half-digested blood all over himself. The bed, the wall, and the floor. It's basically a scene from The Exorcist. I had to dive out of the way and somehow was unscathed. He couldn't stop for almost 10 minutes as we're trying to get this thing down to where it needs to go. Finally finish placement and it immediately suctions out 3 liters of this black sludge that is old, digested blood. PT was mortified and we had to play it off like, oh no, it's fine. It's really common to vomit during the procedure. We'll just go get some towels and clean you up. My coworker and I left the room and just stared at each other in silent shock. Had a patient who needed a lower GI study to fix a bowel bleed. To get a study done you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45. 15 minutes before my shift ends. He calmly says, "I kinda want to try and poop." He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took 1 step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of poop. In my 9 years I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes, and sopped it up. Told him this happens all the time. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left turned without checking. He had gone over the hood, slid and somehow somersaulted landing on his ass sitting up. He slid across intersection mostly on his ass, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his ass. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. Edit. Thank you for my first gold. Not a medical professional, but a story about my father. After years of a blood disease, his spleen had to be removed as it had swollen to a size that made breathing difficult. Apparently the surgeon had a photo taken, post-extraction, where he is cradling my dad's 22.0 spleen. To top it off, 1 day into recovery, when doing one of those gentle push on the abdomen type exams on him, my dad's sutures catastrophically failed and he let loose a spray that coated the doctor, his nurse, and a good portion of the ceiling. Luckily for Dad, the hospital staff was on point that day and kept him alive despite his body's best effort. I heard all of this from the doctor while he was removing the line of staples that went from crotch to sternum some weeks later. Dad didn't like to share, apparently. I had to have my leg rebuilt after a car accident and was eventually sent to Duke University for my surgery. My surgeon was supposed to be like the best orthopedic surgeon in the country. I think he used to work for the Baltimore Ravens. Anyway, all the doctors from my hospital at home were very unsure if I would even have a functioning leg, let alone walk normal again. The first appointment at Duke, that dude told me it was really not a big deal and he would have me fixed almost good as new. I honestly thought he was just trying to be nice and optimistic, but he was very serious. 5 months later I was walking and learning how to run again. He said I was one of the most complicated surgeries he has had to do and a group of surgeons flew in to observe him do it. The dude was either super confident in his skills or a great liar. I will go with super confident since he called in a team to marvel at his work. My aunt started her nursing career in a county hospital, which means you get all the homeless folks. A guy came in with the whole of the back of his leg and butt utterly and very deeply infested with maggots. He just hadn't gotten around to coming in earlier, he said. The depressing thing is that while it was a first for my aunt, it was by no means the last. Apparently it's more common than you'd think. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me, he just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat and I'd make sure someone was with him right away. How the can you be so nonchalant about crushing your thumb into oblivion? Young man, 18, apparently comes in about something else, trying to work up courage, right before he should actually be leaving. This can be really annoying if there are people waiting. He says, I need your advice. I'm having sex with my mother. What do I say? Oh my god, no, I didn't. I said, this isn't the first time someone has told me this. This wasn't true. Turns out that he knew it was wrong. That mother had initiated it. He was trying to extricate himself, and he was desperate for help. But the thought that someone else had been in his position meant to him that he hadn't been judged, that he wasn't doomed or would go to hell, and that there was hope. But he didn't know what to do because the person to whom he should have looked for advice was actually his abuser. But the lie helped diffuse the situation. In 2011 I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Third time's the charm. I was the patient actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery, was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg, and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube through my neck, and I was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was very much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love, and eventually trusted her enough to let her read my medical records. I had never read them, because it's a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one hell of a poker face. Not a medical professional, but my mom is an RN, and boy has she had some stories over the years. Yet, one in particular stands out. She had a male patient come in with extremely swollen penis, like the size of a Pringle can swollen. She said it was the biggest penis she ever encountered in her decades as a nurse. He claimed he broke it during sex. She had to put a catheter in. The guy was freaking out and she had to reassure him that this was a walk in the park for her, but she was seriously questioning how to get the catheter in. She called in her coworker to help steady his well, also so someone else could just witness what she was seeing, while she gave him every painkiller she was legally able to give, and stuck the catheter in. Got it in the first try. Thankfully, she still doesn't know how she managed to get it in but was thankful she did lol. Eventually it came out that he hadn't broken his during sex but actually masturbated after cleaning his fish tank without washing his hands and got an infection from it. Neutral face.